Hi, everybody. Welcome to another episode of the Atlantic CIL podcast. The Atlantic Center for Independent Living is, of course, the Center for Independent Living in Atlantic County, New Jersey. I'm the Executive Director, Donald Campbell, and today we're going to do something a little different. We're going to interview one of the center's staff members, Anna. Hi, Anna.
Hi.
And Anna's saying hi to all the people who listen. And Anna, you've been with us how long? When did you start working here?
I believe middle of January this year, so almost a year.
Almost a year. Well, time flies when you're having fun. Well, we're very happy to have you. So let's talk about what do you do at the CIL? What is your role?
So I am a transition specialist. I am the bilingual staff member. I speak Spanish. And one of the many things that we help is we help students transition from school to the workforce or from one school to a different school, maybe college. We also help college students acquire life skills that will help them excel during college.
Yes, yep, and that's great. We also help transition. Transition is one of the 5 core services of any center for independent living. We also help people get resources to transition if they live in a nursing home or a more isolated setting in the community and they want to live somewhere else. Or if they are without our services, they would be homeless or go to back to prison. So that's the type of transition services we help with,
Yep.
and that any center will help you with across the country. So Anna, you were talking about kind of the life skills we do in colleges. I know we've done some work at Atlantic Cape Community College. You want to talk about that?
Yeah, so one of the first things I did when I started working here was reach out to different schools and including our local colleges and universities. And Atlantic Cape Community College is one of those that partnered with us. So last semester and already started this semester, we have a few life skills that we are presenting and workshops to their students. Among many other ones, we are doing social skills, stress relief, recognizing misinformation. There's quite a few life skills that we're working with them.
Yep. And you do them both in English and Spanish. If
they're available to both. Yes.
If they're requested. And the other thing you're doing at the CIL, because you've already grown in popularity, Anna, is you're also doing the public health grant that we have. We got a grant from the state to help promote public health and wellness for individuals with disabilities, really relating to COVID and the pandemic. So talk a little bit about that and the workshops you've done under that grant.
So the public health workforce grant started back in May. And since it started, the first thing we did was start promoting in social media and kind of using social media to give everybody who follows us tips and ideas on how they improve their life skills. And this public health workforce grant includes several life skills workshops that are available to people who have been affected because of COVID-19. We did notice that COVID-19 affected some individuals more than others, and those are the communities that we want to reach out to. We have several workshops available.
And the topics include a lot of health and wellness stuff, correct?
Yes.
Like stress management, healthy eating, stuff like that.
Yep. Emergency preparedness.
Yep. All good stuff that COVID has really taught people with disabilities that it's really important to be prepared and to live as healthy as possible and to control what we can control, because, this pandemic has shown that really anything could happen, and we want to be able to be okay when these things happen and do the best we can. So that's the idea behind the grants. And these are also available in English and Spanish. And you've done the workshops at different places. Tell us a little bit about where you've done the workshops, just so people get an idea.
So we have gone to different locations in Atlantic City. We have gone to the Mud Girls location. We have gone to Oceanside 2 in Atlantic City, and in Galloway, we went to the Galloway Senior Center. And in Pleasantville, we went to the St. Peter's Village located in Pleasantville.
Yep, that's awesome. And those are all great organizations that we're so lucky to have worked with. And now I always like to talk about like how people get to the center and how you ended up here. I mean, I know, but the audience doesn't know. How did you end up working on the cell? Kind of give us your origin story. Like, it's like Spider-Man, the first comic, and we gotta
So,
figure out how we got here.
I believe starting back in November, I was looking for a part-time job and nothing was clicking. And then a friend of mine suggested that I apply here, and I was very motivated to be hired. And I'm very glad that I was hired. I really loved it here.
Yes, and you have a lot of experience assisting people with disabilities,
Yeah.
and we always laugh because during the interview, you told me you didn't, and then when you got the job,
I have no relation with absolutely anybody with disabilities.
and as we discovered that you help
I
a lot.
actually do.
A lot of your loved ones have a disability. So to the extent you feel comfortable, you want to talk about that. But I just think it's an interesting point because I think sometimes people don't realize how much interaction they have with people with disabilities,
Yeah.
even if they don't have one.
Anything from family members, friends, their children, and
Yes.
you don't realize because maybe you grew up with family member and you don't think about it, and then you're like, oh yeah, that's right.
Yes.
It's reality.
Yes, and that's why we always talk about why it's so important, like disability rights and disability
Yes.
access and programs that support people with disabilities. Because even if you don't have a disability, which you will if you live long enough eventually, you
Eventually.
probably have a loved one that does and will require these services. So
And the disabilities could be physical, but they could also, you might not be able to see them
right.
yourself.
That's a great point, and it's a point that always we got to repeat over and over again, because just because you don't see a disability or they don't fit a stereotype doesn't mean a person doesn't have one. There's chronic pain disabilities, there's mental health disabilities, there's of course physical disabilities, but there's more intellectual disabilities. And somebody could have a disability like a chronic pain disability. Some days they're okay, and some days they're
not.
They're not. So you could look at somebody and say they don't have a disability. I saw them last week and they were fine. Well, that doesn't mean that they're fine.
And then today they can't even move.
Yes. Yeah. So it's just important to keep that in mind, and we should really expand our definition of disability. What do you like about this job? What have you enjoyed the most?
It's a sense of helping people, and not only helping people, but how appreciative everybody is when maybe all you did was give them a phone number that they've been looking for days, and now you just gave them that little bit of information, but they're so grateful to that help that comes their way. And to be able to do that, it's very fulfilling, and it's a good thing to look forward to when you come to the office.
Yes. And what have you, as you've been working with individuals with disabilities, what have you seen as the biggest challenges?
There are many people with disabilities who have nobody who can help them fill out that form or make that phone call, or even something as simple as advocating for themselves, because maybe part of the disability is that they cannot express what they're trying to say. And we all know if you call Comcast, it might be an all-day thing, and they might need that person to assist them in advocating for themselves in a phone call.
That's a great point, Anna. There's a lot of, and that's really what we do at the CIL. We become people's support system for a lot of things, and I think you gave a great example with calling Comcast. There's a whole lot of skills. There's a whole lot of skills and navigation you need to be able to do. I mean, I call Comcast. It's very frustrating. If you don't say the exact right thing to get to exactly where you need to go, you're not gonna get there's a whole anywhere. It's like you gotta get past and then talk to a live person is even like you gotta break the code to get into a live human being. So these are the type of things that if you have a disability, well, you may have trouble with. Some people with disabilities, they call their doctors, and sometimes doctors are are
Mhm.
dismissive, or because they're busy, they get a lot of things going on. So not everybody has a person that can really help them navigate the
Yep.
system, and we help them do that. And the good thing about us is the majority of people that work here have a disability, so we know kind of the tricks to advocate to get the things that we need. You talked about these forms for different programs. I mean, they're not easy, they're
No.
complicated. And
Correct.
if you don't fill them up exactly right, you know,
Or if you
it's
fill
easy
out
to,
the wrong form with that was dated, it's done. Redo,
yeah,
start from square one. Yep. Yeah.
yes, I agree. One of the things you've also been able to bring, you talked about it a little bit at the beginning, is, you know, bilingual services. And I think that's so important. And you can talk about this. There's a whole population out there that needs the help also, but if you can't speak the language, you can't really reach them. So it's very important that,
Yeah.
you know, as a center to have you around, because there are a lot of people who, you know, they're just living their lives and
Yeah.
they speak
Kind
Spanish
of,
and that's what they do.
yeah, chugging along, I would say. And I have found that a lot of times, just because they don't have somebody who can explain simple information to them, that they're not getting the help that they can have. And because they don't know how to fill out this form, so they don't know where to start.
Right.
Or something as simple as, I submitted it, but I got denied. What do I do now? Or they think you get denied and it's over, and it's not.
Yes. Right. They don't, again, it goes back to that navigation, and it's doubly
Mhm.
hard if you don't speak the language,
Yeah.
because it's like, oh, I got denied, but maybe you don't understand there's an appeal process, or you can start
Mhm.
again, or, you know, so it's just really important. And it's also about making people feel comfortable. I mean, when
Mhm.
they see somebody else who can speak their language, it's like, okay, now I can express myself and don't have to worry about
Completely.
being
Yep.
misunderstood or, you know, misrepresented. Because I've noticed that too since you've been at the center. It's just easier for people, which I understand, because,
Mhm.
you know, I'm sure if you just speak Spanish and you know this, it's like exhausting. You like, I gotta constantly explain myself to these,
To
you
a new
know,
person. Yeah.
people, and then it's like, oh, forget it. Like I just won't get the service,
Yeah.
you know, or I won't ask for what I need. But like you said, then you miss
You
what,
miss that opportunity or that assistance. Yeah.
yeah. Yeah, so if you know anybody out there who you're listening
Mhm.
to this, who, you know, maybe they either just speak Spanish or they speak English, but they're more comfortable in Spanish, because, you know, Anna, you
Mhm.
taught me that too. There's
And I
people
have some
who,
consumers that they do have somebody like a daughter or a son, but sometimes the daughter or the son are working because it's
right,
9 to 5 and they might be working. So I am available, so they can call me, or when they go to the doctors and they want to say something to the doctors and they don't have anybody who can translate for them, then I'm available.
yes, and that's a great point too, and that also enhances that person's independence, because instead of waiting for somebody to translate, like if it was me on the phone, I would need somebody to translate. But like you said, maybe that loved one's at work,
Right.
but now they can just talk to you. So that's
Mhm.
a great point. Another thing I mean, you've helped with so much, but another thing you've helped with is, you know, at the center, we help people with access link applications.
Mhm.
So people call access link, and then we help them with the applications and help them do the application and maybe get approved for access link. And I know you enjoy that. Tell us a little bit about that process and
Yeah, I
sort of
love
how
that.
that's
When everybody signs up to apply for Access Link, they get scheduled an appointment to fill out the assessment. And one of those people who is in charge of calling a person and going through the assessment form and filling it out to the best of their abilities. And we are their advocate. We want to work with them and make sure that this assessment fully expresses exactly how they feel and how their disability is not allowing them to use the public system that's already in place all around New Jersey. We interview people from all over New Jersey, a lot of people from North Jersey and some people from South Jersey. We kind of get assigned it seems very random to me. So I don't get to pick and choose who I interview. We get a schedule every week. Yeah, I am
Yeah, and I
basically
know,
their advocate for writing that assessment for them.
yeah, and I know you've enjoyed that because, like you said,
Yes,
you don't know who you're gonna get, and you meet all kinds of people, and you get to
I
help
have
them
learned
with.
so much from everybody who I've interviewed. It's almost like I learn something new every day when I do a new interview.
Yes, and like you said, it's the challenge is because for those of you that don't know, so Access Link is the paratransit system in New Jersey, and to get approved for it, you first have to show that you can't use the standard New Jersey bus that they say is accessible and should be enough before you get. So you have to
Mhm,
show that you can't use that bus first. And you do that by filling out an application. And we don't work for Access Link, but we assist with the applications because we're a
mhm.
nonprofit that helps people with disabilities. So they refer people to us. So Anna will get a call and someone will say, apply for Access Link, and they will ask them questions, and she has to make sure that they're expressing their disability and connecting it to
Not being
their
able to travel.
not being able to travel using the other bus. So this is a good PSA too for somebody who signs up for Access Link but also doesn't get referred to us. Don't make sure you explain yourself. Don't just say, I don't like public transportation, so I want to use Access Link. And that's not good enough. You got to say,
Mhm.
because of my physical disability, it's hard for me to walk to the bus stop.
Yeah,
And it's hard for me to
maybe
um,
wait
maybe
for the bus.
wait for the bus. Exactly. You got to connect it because of my mental health disability. I get,
Mhm,
a lot of anxiety waiting for the bus, and it's not safe for me to go to the bus because sometimes I'm not clear about where
mhm.
I'm going and where my destination is. So you got to really connect it. And then that brings me to another point. I know that when you're a person with a disability, a lot of this stuff can feel like getting these programs. It almost feels like a little bit of a game, but it is true. You got to understand what these services are asking and
Mhm.
give them the information that they need, of
Yep.
course, truthfully and honestly. But you want to make sure you're expressing it in a way, and that's not easy for everybody, like Anna was talking about,
Yeah, it's
where
not
it's
easy.
clear for the person deciding whether you get services that you need these services, that they can justify it to whoever they need to justify it
Yeah.
to
And
give
you'd be
you the resource
surprised
you need.
how many people will tell me that they have one disability, but as we go through the form, they say, "Oh yeah, I really can't stand too long because I have X, Y, and Z." And I'm like, "Oh, that's another disability. So let's add it to the list." And as long as
Right.
they make sure that the doctor also corroborates everything that we put on
Right.
that form, it will get them that much closer to being
Right.
approved.
I remember hearing a story from when, I only have a physical disability, but then I do have a heart condition
Yeah.
that acts up. It's like, yeah, we should put that in too,
Yeah.
because we want to make the best case
Yeah.
possible. So, and then again, thinking about disability more broadly, I think sometimes society has taught us to hide our
Hmm.
disability and to not um talk about it, but
Hmm.
you shouldn't be embarrassed to talk about it. And that's changing, I think, as society has evolved, although we take one step forward and two steps back, and
Yeah.
it's a constant struggle. But I think that
Yeah.
you need to tell people, especially these agencies, your whole story,
Hmm.
because and not your whole story in the sense that you want to drone on and on, but you want to give them the precise information they need. So if you're
Yeah.
getting a question saying, how does your disability affect your ability to use transportation, you want to put all your disabilities and talk about how it affects
Hmm.
transportation. You don't
And
want to go,
be as
I'll leave that one out. You
yeah,
want to
be
talk
as
about it.
descriptive as possible
Right. And clear,
and
clear,
clear.
connected to what they're asking. Yes, this my knee that I've had knee surgery on hasn't been the same for 10 years, and now I can't walk to a bus stop. Like, you want to
Hmm.
make that
Yeah.
clear. We've talked about life skills, we've talked about public health, talked about
Yeah.
bilingual. What else? What else? I feel like you've done so much, Anna. I feel like I'm forgetting. I feel
I'm
like
trying
I'm
to think.
I feel like I'm forgetting something.
I have done quite a few outreaches,
Oh,
and
let's talk about
especially
that.
with
Yes.
public health. We have done the Galloway National Night Out this summer, and just recently we did the Caregivers Coalition in EHT.
It's awesome. And have you enjoyed that? How's that been?
We have met so many people and connected with quite a few companies, and
Yes.
yeah, and
you were able
gotten
to
our voice out there so that people can find us as well.
right, because that's a big key too. And I would encourage people, if you can, to go to those. There are a bunch of outreaches all over the community, and when you see them, sometimes you think, "Oh, I don't know how that applies to me," but you never know what kind of resources you'll
Mhm.
find out there. So I would encourage people to go to those, because I know we're always surprised. We always sometimes find something new. Oh, I didn't know about that. Oh, that's interesting.
Yeah.
You know, but yeah, you're all over. So people, if you see Anna, say hi.
Say hi.
Tell her her on this podcast. Funny story, everybody. I just told her today she's gonna be on the podcast. So she was like, "Oh, I'm making my debut."
Yeah.
Making my debut. So she's the first staff member. I promise there will be more staff members. I talked them into
They can meet all of
doing
us.
starting to trend. But Anna broke ground. She's breaking ground right now. Being the first Atlantic CIL staff member on the podcast. So I'll give you the floor if you got anything else you want to say, and then we'll wrap up.
One more thing, I just want to emphasize that if you do know somebody with a disability and you do hear about us, do not hesitate to mention that we are a company that's available, because you'll be surprised how many people say, "Oh, I didn't know you were available to us." Yes, we are.
Right, yeah.
So if you found this podcast somehow, make sure you share it.
Yes, that's a great point. And we serve Atlantic County. We can also connect you to the center in your area. So if you're like, "Oh, I like these centers, but I'm not in Atlantic County," well, there's a center around your area, because centers exist nationwide, and we have no problem connecting you to the center that you serve. And if you know someone with a disability, or you have a person, or you have a disability yourself, and your phone rings during your podcast, you can always call us or reach out. And our number is 609-748-2253 extension 5. And you could call me possibly during a podcast interview as well. And then I'll get back to you when you leave a message. So I appreciate it. Thank you, Anna, for joining us. And
Thank
this is a
you.
great first step interview. You set the bar high. So
Thank
we'll have to
you.
compare.
Thank you for having me.
You're welcome. Bye, everybody.
Bye.